Hi, my name is Deepak Chellapandian. I'm a pediatric hematologist and oncologist at Johns Hopkins All Children's Hospital. I specialize in bone marrow transplant for children with cancer and blood disorders. I'm the division chief for the blood and marrow transplant program and the medical director for the Center for Cell and Gene Therapy for Non-Malignant Conditions. I'm passionate about treating children with rare blood and immune disorders using cell and gene therapy. To help patients with these conditions, I founded the Center for Cell and Gene Therapy for Non-Malignant Conditions in 2020, the first program of its kind in Florida. Our team includes experts like BMT physicians, immunologists, hematologists, and dedicated staff. We focus on treating rare non-malignant diseases like sickle cell disease, bone marrow failure conditions, metabolic disorders, and primary immune deficiency conditions. The use of cell and gene therapies to treat children with serious and life-threatening non-malignant conditions is growing rapidly. Our program aims to make these treatments accessible to families in the southeastern part of the country. Our goal is to accelerate the delivery of promising new cell and gene therapies in the southeast region of the country through collaboration with a wide range of academic and industry partners. In recent years, we have made great strides in making transplants safer and more accessible, even for children who don't have a perfectly matched donor. For a successful transplant, finding a matching donor is critical. Unfortunately, many patients, especially those from minority groups, struggle to find a match. We have developed a new clinical trial using a genetically half-matched family donor, which expands options for those without a full match. This novel clinical investigational approach is expected to reduce risk associated with traditional transplants. There are certain non-malignant conditions that are characterized by defects in single gene, also known as monogenic diseases. This includes diseases like severe combined immune deficiency, sickle cell disease, beta thalassemia, and few others. Some of these disorders can be cured or ameliorated with a novel treatment modality called gene therapy. Gene therapy uses the patient's own stem cells to fix a genetic defect, eliminating the need for donor. This approach often requires use of mild conditioning regimen and eliminates the immediate and long-term complications associated with traditional transplants, such as graft failure, graft versus host disease, extended immune suppression, and organ damage from strong chemotherapy. Our program is collaborating with academic and biotech partners to run gene therapy clinical trials for many of these conditions. We have started with offering gene therapy trial for sickle cell disease and plan to expand to other diseases in the near future. Over the past 5 years, our program has completed up to 45 bone marrow transplants for non-malignant conditions, representing 42% of our total transplant volume and reflecting a tremendous growth. Our 1-year survival rate has exceeded 95%, with the majority of these patients cured of their underlying conditions without major complications from their transplant. To conclude, our cell and gene therapy program represents a new frontier in treating children with rare and life-threatening non-malignant conditions. By harnessing cutting-edge therapies, we are not only improving survival rates, but also enhancing the quality of life for our patients. Our focus on innovative approaches, such as gene therapy and use of half-matched donors, allows us to expand treatment options and bring hope to families who previously had few choices. We remain committed to advancing these therapies, collaborating with partners, and ensuring that patients in Florida, as well as from the southeast part of the country, have access to the latest and most effective treatments. Thank you for your support and dedication to this important work.